This animation will describe abduction of the arm, or pulling the arm away from the midline of the body. There are a few bones, muscles, and nerves involved in this process, so let's explore each of these. Behold, the clavicle, or the collarbone. The lateral end of this bone forms an articulating joint with the scapula's acromion, called the acromioclavicular joint. During arm abduction, the clavicle pivots on the sternum to help raise the scapula 60 degrees. The large but shallow socket of the scapula is the glenoid fossa. The head of the humerus articulates with the scapula at this fossa, forming a joint called the glenohumeral joint. The humerus is able to rotate nearly 180 degrees vertically at this joint. This action is abduction, as the arm is moving away from the midline of the body. The ulna and radius, bones of the forearm, tag along for the ride as the humerus moves about the glenohumeral joint. There are three muscles involved in abducting the arm. The supraspinatus originates on the superior surface of the scapula and inserts on the greater tubercle of the humerus. When the supraspinatus contracts, the muscle pulls medially and superiorly on the humerus, thus initiating the abduction. The contractile force of the supraspinatus will abduct the arm about 18 to 20 degrees. The deltoid originates on the clavicle, acromion, and spine of the scapula, and inserts on the deltoid tubercle of the humerus. The force of the deltoid will abduct the arm until the arm has been elevated 90 degrees. The trapezius originates on the external occipital protuberance, nuchal ligament, and spinous processes of C7 to T12. The trapezius inserts on the lateral one-third of the clavicle, acromion process, and spine of the scapula. The force of the trapezius will abduct the arm the remaining 90 degrees to complete the full 180-degree range of motion. Nerve damage can be diagnosed by understanding each muscle's nerve innervation and range of motion, or lack thereof. The supraspinatus is innervated by the suprascapular nerve, a nerve originating from the dorsal rami of C5 and C6. The deltoid is innervated by the axillary nerve, a nerve also originating from the dorsal rami of C5 and C6. The trapezius is innervated by the accessory nerve. This is a cranial nerve, or a nerve branching directly off of the brain. Injury to these nerves will decrease an individual's ability to abduct their arm. Damage to the C5-C6 region may damage the suprascapular nerve, thus causing the supraspinatus to be unable to initiate the abduction. If that nerve is spared, but the axillary nerve is damaged, then the individual will have difficulty raising their arm using their deltoid. If the accessory nerve is damaged, then the individual will have difficulty raising their arm the remaining 90 degrees using their trapezius.